Hey everyone, thanks for watching. Earlier today I posted a question on my Instagram of, what do you guys have for questions? And we don't have much time tonight because it's 10:30 and we have to go back for our fourth shift tomorrow morning. But we wanted to answer some of the most common questions that we got. What was the first one?
The first, people are wondering about ratios and if it's true that we really have 6 vented ICU patients. Well, Carissa can answer that.
Yesterday I had 7 ICU patients. If you're wondering what we normally will take care of as an ICU nurse, it's 2 patients, sometimes 1 depending on how sick they are. A few of the patients that I did have would typically be a 1-to-1 is what we would call it, 1 nurse to 1 patient ratio, but I was taking care of 7 total. They were all on ventilators. I did get a clinic nurse, somebody who doesn't work bedside, to help me pass meds, which was immensely helpful. And what's interesting too is that every unit in the hospital has basically been turned into an ICU. Some were ICUs originally. The one that I'm in is actually an old cardiology office area, and they actually had to add like the oxygen and all of the supplies in the rooms so that we could utilize it for patient care. But Lauren today was in a unit that's normally an ICU, so it was a little bit different.
Mm-hmm. Yeah, yesterday I was on a step-down unit, which was essentially a whole ICU, like Carissa said. That's how every floor is. There were 30 beds and I think 28 vents. So yesterday I had 5 patients and a med-surg nurse to help. And then today on the ICU I did only have 3 patients. But yeah, that's because it's like they kept it the ICU. So yeah.
It's interesting how different it is across the hospital, and how, because of how fast it's all happened, they haven't quite been able to manage all of the new staff and all of the staff that's calling in sick every day, and keeping like the balance of nurses across the board the same. What are we getting for PPE? We, on our first day of orientation, we were told that we were going to get an N95 mask and that it was to last us for 5 shifts. 5
they get pretty
13 plus hour shifts.
Yeah. For all you nurses out there, you know how uncomfortable they can be and how gross they get. So
they are also telling us now that we might have to limit our gown use, but we'll have to kind of see how that goes. That hasn't really been enforced yet. But today would have been our 3rd day with the N95 mask. Full disclosure, they smell disgusting.
Mm-hmm.
They're soggy.
Claustrophobic, can't breathe.
They're gross. I do feel like they're still sealed. Mm-hmm. I don't feel like I'm letting air out, so I still feel safe, and it's just a matter of sucking it up and getting used to having it on.
Like, literally, you have to wear it at all times because the entire hospital is
COVID positive.
Yeah. Mm-hmm. And you're pretty much shamed if you have your mask off. So pretty much the only time we take it off is during lunch break when we go outside to eat. Mm-hmm. We'll send some pictures tomorrow of us in them, but it's a respirator and it'll cover our entire face because right now we're wearing goggles as well, but this will just be a tighter seal and hopefully more comfortable because like the N95 on your nose can get pretty uncomfortable after a while. So
the last question we're gonna go over is some people asked how many people that we're working with are actually like regular staff from the hospital, and I don't really know the ratio because we are working with different people every single day, but I feel like the majority of people that I meet are agency nurses, which is what we are. There's actually the majority of these nurses they're called crucial nurses. That's the staffing agency that they're hired through, which is not what we did. These people are much crazier than us, and they're actually contracted for 21 days straight to help with relief of all these sick calls and stuff that this hospital is getting, or all the hospitals in the area are getting.
Yeah, I feel like pretty much 90% of the hospital is probably crucial staff. Our group, a lot of people have been asking who we're using, and it's called New West Medical Group. And if you're thinking about coming out, I'd highly recommend them. They've been amazing to work with and got us out here pretty quickly, like within 5 days of when we decided to go. So if you want to come help, check them out.
Hopefully tomorrow we will come on here again and answer some more of the questions that were sent. And if you think of any others, just message me on Instagram.
Yes.
Thanks, guys.
Thanks for watching.